progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
We've all heard of diabetes and we've all heard of obesity, but not everybody knows what metabolic syndrome is and how it can contribute to some of these situations. My guest today is Dr. Linda James. She's a hospitalist and a member of the medical staff at Palmdale Regional Medical Center. Dr. James, tell us, what is metabolic syndrome?
Yes, metabolic syndrome makes up of 5 risk factors, and those 5 risk factors include heart disease, diabetes, stroke, high blood pressure greater than 130 over 85, high blood sugar, or insulin resistance. So those are the things that make up the metabolic syndrome.
So let's start with insulin resistance then. People don't always understand what that is, and I'm an exercise physiologist, so I've been kind of teaching people this for years, but explain for the listeners what that means when you say the word insulin resistance.
Okay, so insulin resistance is when you're not producing enough insulin, and therefore your sugar levels are going to be elevated.
So you're not producing insulin. Is your body able to use the insulin that it does produce?
Yes, you can use what your body produces, but it's not producing enough, and it doesn't function as well.
So what are some of the risk factors for somebody with metabolic syndrome?
If you are overweight, that's a big reason why you will have metabolic syndrome. If you have increased body girth in your abdominal area, that's a risk for heart disease as well as strokes. Being your BMI is over 27, that's going to put you at the beginning of being obese or overweight.
If somebody is diagnosed with metabolic syndrome, what's the first thing that you recommend? Medicational intervention, or do you try and get them to exercise and take up healthier lifestyles?
The first thing you want to do is a lifestyle, healthier diet, exercise.
And then what? If somebody tries those things and they're not working for them, are there any medicational things you might try with them?
Yes. Well, we want to first send them to a nutritionist to help them to figure out what they're doing to make the changes that they need to get to the goal. Then the next thing we're probably going to do is do some lab work. We want to look at their hemoglobin A1C to see what is the risk factor for diabetes. Are they in a normal level for their hemoglobin A1C, for their risk, or are they a pre-diabetic, or are they at diabetic level? So what we want to do is look at that first, and then after we look at all of that, and if they're pre-diabetes, you're going to be at a number between, depending on what lab you're looking at, 5.7, 5.8 to 6.4, and that's pre-diabetes. Many of the labs look at 5.6 as the cutoff for normal. So if you're between 5.7, 5.8 to 6.4, we're going to call you a pre-diabetic. And then at that point, we'll give you maybe 3 months for diet and exercise. And then after 3 months, we will recheck. And at that point, we're going to then, if you're still between the 5.7, 6.4, you will be put on metformin. And that will help with the pre-diabetes.
So then give us your best advice, Dr. James, as we wrap up. Really, what would you like people to know about metabolic syndrome, their risk for diabetes, heart disease, so many other comorbidities that can come along with this umbrella term? What would you like them to know about hopefully preventing it in the first place?
I would like to let people know that healthy lifestyle, a healthy diet, being active on a regular basis is going to keep you from getting this disease or the syndrome of diseases.
Thank you so much, Dr. James, for joining us today. You're listening to Palmdale Regional Radio with Palmdale Regional Medical Center. For more information, please visit palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for tuning in.